Okay, well, welcome everyone. Thank you for joining us. I'm going to get us started. So, my name is Mona Bormet, and I'm the program director at Christian Connections for International Health. And I am so glad you are here. We are grateful you're here for the session today on the power of influencers to influence social norms about family planning. So hopefully you're excited to talk about those topics. Our session is a hybrid session, which means that people are in person, but people are also online, and this will be recorded and available later. Our session is also a mix of presentations and then interactive using the fishbowl format, and I will explain later what that means. So welcome again, and I just wanted to give a short introduction about why we think this topic is so important. So the percentage of healthcare provided by faith entities in low and middle income countries is significant, but it varies widely from country to country. And faith entities are a critically important component of the overall health system in many countries. I hope you all agree with that. And promoting healthy families is central to faith communities, but there are often misunderstandings about how one can and should engage faith actors. So the interventions that you'll hear about today focus on the importance of engaging with trusted influencers in one's community to affect change, whether that is for family planning uptake at the community level or to influence policy and financial decisions at a county or district or national level. So panelists will describe partnering in different countries with trusted influencers to advocate for family planning uptake, policies, and financing. So each speaker will have 10 minutes, and then we'll move to Q&A, which we'll do in a fishbowl format. So once again, welcome, Karibu Sana. Did I say that right? Hopefully, Karibuni Sana. I don't know the plural. I should have said Karibuni Sana. We are glad you're here. So our first speaker today is Wilma Mui, who is the program manager at World Face Development Dialogue, which I will refer to as WFDD, because that's easier. And she primarily supports their projects on maternal and child health in Senegal and Guinea. She served as a Peace Corps volunteer in southern Senegal from 2010 to 2013. Working with local communities on a variety of health topics. And before WFDD, Wilma worked with the Grandmother Project in Senegal as a community health and development consultant. She has a Master's of Public Health from Emory University. And so today we will start with Wilma in West Africa. So welcome. Bonjour. That's all I know in French. Please help me welcome Wilma. Thank you.
Hi, everyone. Good afternoon. Thank you, Mana, for that lovely introduction. So today I'll be talking to you about one of our programs in Senegal and working with Ndeyu Dara. So I refer to them as hidden influencers. So a little bit of background. WFDD has been working with CRSD, Cadre des Religieuses pour la Santé et le Développement, in Senegal since 2014. And it really just started off as an idea of taking religious leaders and working in family planning. Since then, they've grown into a recognized NGO in Senegal and work on a variety of different family planning initiatives. So when we first started working with CRSD, their approach was really to work with religious leaders and married couples. They would go out to the communities and in pairs. So it would be a religious leader and a health professional. The religious leaders would give the religious argument in support of family planning, and the health professionals would give the technical family planning information. As we all know, in 2020, the COVID-19 pandemic hit, and so we had to shift our approach. And in that, it kind of shook up the landscape and new ideas were able to emerge. So in 2021, we worked with a really dynamic midwife who's part of CRSD, and she runs a clinic in Dakar, and she came to us with a concern and an idea. She saw in her clinic that these young adolescent girls were coming in and they were seeking pregnancy services. And she discovered that a lot of these girls weren't in the formal education system. They were in the Quranic school system, the Daras. And she was thinking through ways of how we could address this population, that there's a huge gap. Because they weren't in formal schools, they were not getting the information or services that they needed. So in 2021, she designed and launched a pilot program where she worked with Ndei Daras. And so they're known as the godmothers of the Daras. They are dynamic women from the community that work with the Quranic teachers to provide support to both the boys and girls within the school system. So in this pilot program, she adapted the approach from before to these specific groups. So they worked with communities to bring in community health workers, the godmothers, the Quranic school teachers, leaders from the community, and to discuss the topic of family planning and for these girls. And so the pilot went well, so we expanded the program in 2022, and we had 13 different workshops in 2 regions, the ones closest to Dakar, and we had over 235 participants. And so the idea about bringing in these different community members, it's really a group effort. There's just not one target group that we can reach to address the family planning needs of these adolescent girls. So in each of these workshops, it's really a discussion of family planning within the religious context, the health aspects, and then we really open it up for discussion. And each community is different, so we really allow the participants to voice their concerns, their observations, and we come up with ideas as a group of how to address it. And we've learned a lot in this year, and we will have to adapt it for future contexts because we have some key takeaways. So with these Ndei Daras, a lot of them serve dual roles. They serve as the godmothers, but they're also often the community health leaders, community health workers in their communities. And so they really are trusted individuals, influencers, in these settings of the Quranic schools. And the Serene Daras, the Quranic teachers, are sometimes skeptical about this approach. They don't want to rock the Dara system that is so entrenched in Senegal, and they're not really sure how to approach this issue of adolescent health and family planning. So we're in discussions with them about how best to discuss these topics without rocking the boat too much. And then obviously there's a value in communicating with adolescents and planning for married adolescents, because in our observations, a lot of these girls attend the Daras, and once they have completed their Quranic education, have memorized the Quran, then they're often married soon after that. So one idea that Rukaya and CRSD has is to create and pilot a program where we transition these girls from Quranic education to the more formal education system so they aren't married as early. We still have to design it and launch it, but it's an idea. And lastly, health is really a key entry point for discussing girls' education and girls' health and girls' futures. In the different discussions, the communities have raised a variety of different challenges that the girls face in their everyday lives and in their future lives as wives and partners and running households. So there's plans to design a program where we provide them with more tools so they can be successful in the future. And so we have some lovely photos from these different workshops, and yeah, I'm excited to see where this program goes and hope it grows to a lot more areas in Senegal. Thank you.
Thank you, Wilma, and welcome everyone. I just noticed as I was sitting there that the speakers can't see the slides, so why don't you come sit in the front row so you can see the slides? Or can you see them? Are you okay? but if you want to move, you can. Welcome, everyone who came in. We're glad you're here. Let me get my notes back up, sorry. Our next speaker is Mr. James Wanda. James is a registered nurse with a Master's of Public Health degree and over 15 years of experience implementing public health projects in Kenya in HIV, tuberculosis, and reproductive, maternal, newborn, and child health. Currently, he is the Scope Program Manager at World Relief in the Kenya office. So, karibu sana, James. Let's welcome. Yay. Oh, you're good. This one.
Thanks, Mona. Good afternoon, everyone. Glad you're here. I'm here to talk about engagement of faith leaders in conservative migratory communities in Kenya as champions for FP and RMNCH messaging. But for a start, let me just say that World Relief implements a project called SCOPE, which is a community-level reproductive, maternal, newborn child health project funded by the USAID. The project utilizes various platforms, including community groups, community health volunteers, faith leaders, and several others. But today I'm here to talk about the faith leader engagement. We are in year 3, but all along World Relief has had a history of working with faith institutions to strengthen community resilience and community organization in programming. SCOPE project builds on that infrastructure of faith leaders to boost community-level messaging in reproductive health services. So over the years, SCOPE project engaged faith leaders in the project areas, which is Turkana and Kajiado counties in Kenya. We started by first mobilizing the faith leaders and not straight going into the reproductive health curriculum, but engaging them on a curriculum that was basically called Making Our Communities Better, which just builds the capacity of the faith leaders to engage the communities in their own development activities that are not RH or reproductive health related. Later on, we embarked on development of the curriculum for reproductive health for faith leaders. We engaged their leaders at both national and county levels, because in Kenya we have devolved systems, so we engage the leaders at those levels to get their buy-in, to get their views on the content that we're going to use, and also just to let them understand what we're going to expect of them, but also share with them what will be the best approach to do this work. We recruited 4 faith leaders per institution out of the 280 plus institutions that we wanted to work with, deliberately seeking to have a good representation of the female faith leaders. So where possible, we worked with 2 couples from every faith institution. Where not possible, we worked with 2 females and 2 males who are not necessarily couples. Most of the time I'll be talking about faith institutions, but largely given the setup in Kenya, I'll be talking about Christians and Muslims, because those are the most likely that will interact with at the community level in Kenya. So after that recruitment, what have we done? We trained the faith leaders using a 5-week curriculum, 1 module per week for 5 consecutive weeks. After that, we had a graduation with them. We developed post-training follow-up action plans to deliberately state out what the faith leaders were going to do within the communities. The 5-module training had a range of topics, starting from discussion of puberty and adolescent body developments, ranging to making healthy choices in life, preparing for marriage, family planning, etc. And so we were able to get the support of 60 key faith leaders at the national and county levels. In total, we had 100 plus faith leaders completing the 5-week training. and developing follow-up action plans, which they're actually doing even now. The faith leaders do a lot of the messaging just to support what the community health volunteers and other operators in the community are doing. And so the project has linked the faith leaders to the community health information system and the community health structure in Kenya, such that they are able to link and refer the clients they talk to get the necessary services at the nearest health facility. Because the faith leaders by themselves are not service providers, but they are champions for communication and demand creation at the community level. So far, we completed this training at the start of this year, 2022, and the faith leaders have been implementing the action plans they developed post-training. So far, we've been able to reach over 20,000 community members, and about 17% of that is the youth, who are largely the target for this project. For this component of the project, we call the Family Life Education, FLE. Beyond the direct benefits of the project, we've had a synergy at the community level where leaders across the faith are able to engage and discuss other matters of concern at the community level without necessarily looking at each other as being different or separate from them. Yeah, so just a few photos. The first one to the left is actually a training. That's a War Relief staff training faith leaders somewhere in Kajiado County. And to the right is a graduation ceremony. After the 5-week training and developing the action plans, the faith leaders congregate, and then there's a graduation, a small certificate of recognition before then they embark to their work. To the left, you can see that's a faith leader actually cascading this message that they learned within the trainings to a group of parents. Now, the parents are not the primary target for the project, but we know that if the parents are also aware of this information, then they can keep the conversations going with their sons and daughters, or even the neighborhood, or even the communities. So that's a faith leader cascading the message to a few of the parents. To the right is a photo taken after an FLE session at the school. We have collaborated with schools because that's where it's the easiest target to get 10 to 24 years of age, which is the primary target for the project. 10 to around 14 will be in the primary school in the Kenyan system. Above that to 24 will be in colleges or anywhere around there, or secondary schools. As we were implementing, we came across a few challenges that I thought it would be important to share with you, just in case you are planning to have such an intervention. Obviously, working in the rural communities means that you're not guaranteed that the people there will be so versed with English and communication. So we overcame that by translating the participant and the trainer manuals into the local languages, and that will be the Turkana for Turkanas and Maasai in Kajiado, and in a few areas we worked with Kiswahili. Some of the terminologies are actually taboo, seen as taboo. We overcame that by having a sit down with the faith leaders and them sharing with us what language will be appropriate without necessarily interfering with the key message that was intended in the modules. And then lastly, there was the aspect of age differences, but we recruited the trainers with a varied range so that we can have peer training where the young will work with the youngs and the old faith leaders will work with the older population. Those are some of the lessons that you might want to pick as you go back to your place and maybe implement this, that it's important to have prior engagement with the faith leaders so that you're not just going straight to RH because it's surely a sensitive topic. So you'll want to coalesce them around a common topic before then you go into RH. And then it's important to engage them throughout, have their input in the content so that it doesn't look very strange to them. Of course, having a mixed age of trainers helps. And lastly, linking the faith leaders to community health volunteers boosts the community health strategy and community referrals for services. Thank you very much.
Thank you, James. Asante sana. So we went from West Africa to East Africa, and in both places we talked about the importance of relationships and trust and having those relationships. I just realized I should take this off. So thank you, Wilma and James, and welcome everyone. Our third speaker is a little unique, always, but on your program it shows that we should have Mohammed Bunbida from Muslim Family Counseling Services in Ghana. Unfortunately, Mohammed was unable to get a visa, and so Mr. Peter Munene, a partner of his from the Faith to Action Network, will be presenting on his behalf. So we are grateful for that. Peter is the CEO of the Faith to Action Network, a global interfaith platform promoting health and well-being, which he helped found. Previously, he worked for the African Network for the Prevention and Protection Against Child Abuse and Neglect, and as the country director for DSW Tanzania, and later as its international affairs manager in charge of advocacy in Africa and Asia. So we are glad to welcome Peter, who will be presenting on behalf of Mohammed Bunbida. So welcome, Peter. Thank you.
Assalamu alaikum. I'm greeting you with the greetings Mohammed would have used. I think that's what he would have used. I cannot speak Ghanaian, so I won't try to speak Ghanaian. I feel very humbled that Mohammed requested me to present on his behalf. But I also feel sad that he could not be with us because this is also a very important space, and this is part of his effort. Faith to Action Network is a global interfaith network, as Mona has mentioned, and we are membership-based. So Muslim Family Counseling Services of Ghana is one of our members. And I therefore feel very humbled that this request came along from him, but I'm also happy that he will be represented and he will not be left behind in this conference by being absent. Saying that, I feel I want to welcome you again to this particular forum. I see as if we have someone from Philippines. I am not very sure. Is there? Is there someone from India? We have someone from Netherlands. Okay, I see no one from Kenya. So with that, then I can start, okay? No, I just wanted us to be together. So thank you so much for being with us. And what I'm going to present to you is something that is very passionate to Mohammed and the Muslim Family Counseling Services of Ghana. It's a process of an advocacy moment or advocacy effort that the Muslim Family Counseling Services of Ghana, whoever is recording, please delete that, of Ghana participated in when they were advocating for the inclusion of family planning services as a package of essential services in the national health insurance of Ghana. And therefore, this is the journey that I'm presenting to you, that in 2012, the National Health Insurance System Act 852, was amended in Ghana to include coverage of relevant family planning services. This included out-of-pocket payments. No, it recognized that out-of-pocket payments are a barrier to uptake of health services. However, even with that particular amendment, the act remained unimplemented for very long. And therefore, in 2016, Muslim Family Counseling Services of Ghana, together with other organizations, about 14 of them, came together And they started the advocacy with the government to implement the act that had been amended in 2012 to include family planning services as part of the package that could be covered by the insurance. But for them to be able to do this, they started developing RIs, or bringing together those that would be of the same mind to be able to accompany them and to advocate with them. One of those is the Office of the National Chief Imam in Ghana. The other one is the Christian Council of Ghana. And they did also a mapping process where they identified various groups that they could reach out to work together, but also those that they also needed to target. One of those is the Parliamentary Select Committee on Health and Legal Affairs, of course, of Ghana. The other one is the Family Health Division of Ghana under the Ministry of Health. In their own case, it's called Ghana Health Services, and the National Insurance Authority of Ghana. And within this process, there are key milestones in this particular advocacy effort. The first milestone is the one on July 2016, where there was now an amendment to the 2012 Act, so that that amendment now allowed for family planning to be included in the benefits package. Some of the elements that were not initially covered by the 2012 Act as it was. And then in 2018, the government of Ghana piloted in 7 districts with accredited services where people who needed these services, family planning services, could get them for free. Then in 2021, a further, the amendment that had been passed was then finally accepted, I think, within their national legislative processes. And clinical methods were now fully covered by the National Health Insurance System, and they were covered at no cost at all. And remember, in 2018, they did a pilot in 7 districts. In 2021, they rolled this program nationally. And also in 2021, the government committed to directly purchase 1/3 or one quarter of all family planning commodities that were needed in Ghana. Part of what has been presented, there is evidence that is available within the Population Council of Ghana, and also in some of the media that covered this process. And one of the things that was seen as an improvement was an increase by 16% of uptake within the pilot districts, the 7 pilot districts, that after the pilot started, uptake of family planning services went up by 16%. Some of the lessons that have been learned in this process is that advocacy is a process. Remember, we have talked about when the journey started, that was 2016, up to when now the government rolls out, the act is amended, and the government rolls out a national program. That is in 2021. That's a period of close to how many years? Around 5. If we are still together, around 5. And you can see that is a journey that you walk, or a journey that you take. It's a journey that requires patience, but then also, if especially you're implementing funded projects, donor-funded projects, you need to then document milestones within that journey, because you never know when that journey would be able to end. You need to document milestones, but also you need to build RIs. The other lesson is that faith is critical in provision of health. And here the note is that in many situations, health services that are provided by the faith community are done within the very remote places. Health infrastructure needs to be able to be improved for it to be able to accommodate. For example, what we are now talking about, universal health cover. If you want to have universal health coverage, then you need to improve the infrastructure. And finally, faith needs support. The faith community cannot be able to undertake provision of health services, neither even advocacy efforts like this without support. And Mohammed would have loved me to show you these photos as part of the evidence of what they did. And I will allow you to read as I scroll down. That is again also the desire of Mohammed. I'm only fulfilling his desires here and trying to be faithful to fulfillment of those desires. That's the regional chief imam of Ashanti, one of the provinces or the regions of Ghana. And Mohammed is the guy in the middle. Yeah? So he is also the one here with the national chief imam during some of the processes that they have been engaged in. And here with other members of the organization that they implemented this particular advocacy effort with. Thank you so much.
Thank you, Peter, for representing Mohammed while he couldn't be here. So remember, we started in West Africa, we went to East Africa, we went back to West Africa, now we're going back to East Africa. So welcome. It is a trip, it's a joy. So our final speaker today is Jane Kishoyan, who is a Kenyan. She's a registered community health nurse, with a Bachelor of Science degree in nursing and a master's degree in public health. She's currently working with the Christian Health Association of Kenya as the RMNCAHFP programs coordinator. Jane previously worked with the Ministry of Health at the county level in different areas, including AIDS and STIs before she joined CHAC. We are glad to have her. Karibu sana.
Good afternoon. Yeah, I'm happy to be in front of you to represent the work that Christian Health Association of Kenya has done. And we have worked very closely with religious leaders, and not forgetting CCIH, who has always been our partner, and more so in this project. So Christian Health Association of Kenya is a national faith-based organization, and we deal with Protestant churches, health institutions, and programs. And we are all in all the 47 counties in Kenya. We have 47 counties in Kenya, and in every county, CHAC is represented. CHAC is an old project, a program that started in 1946. And it focuses on quality health systems, partnership, and community empowerment. The vision of Kenya is quality health care for all, for the glory of God. And our mission is to facilitate provision of quality health services through health system strengthening, innovative health programs, training, advocacy, and partnership, as we witness the healing ministry of Jesus Christ. Christian Advocacy for Family Planning in Africa, that's a project, in short, CAFPA. And as I mentioned, this project, we worked together with CCIH, and the project was funded by Gates Foundation. And we implemented this project for 7 years. And it actually ended last year, December 2021. And our objective was to increase investment for family planning and HIV policy, and also deal with policy issues, and also increase capacity among faith-based organizations and religious leaders to advocate for improved family planning and HIV services and resources in Kenya. Our third objective was increased engagement of faith-based organizations and religious leaders as advocates in the global community. Some of our project achievements, in the beginning we trained 56 religious leaders in advocacy for HIV, family planning, and GBV. And it's important to note that religious leaders can help you succeed or help you fail in any project. Because we realize that, yeah, it is true. Because our community, especially in Africa and more so in Kenya, we have a very strong belief in our Christian or Muslim belief. And for this project, we actually also worked with the Muslims. And when a Christian religious leader tells you not to use family planning, back at home, they will not use that family planning. But if they support it, then you'll succeed because they will all follow. So as we trained them on advocacy, we also trained the religious leaders to track county family planning and HIV budgets, and also to be engaged in policy development and policy reviews. We also developed, helped the two counties, that was Kiambu County and Murang'a County. We actually worked with the Ministry of Health to develop their family planning costed implementation plans. And this was a very successful thing for us to be engaging with the counties and to come up with those important documents. And we also worked with the religious leaders to reach out to the youth through messages, through the youth forums across the counties, reaching up to more than 6,000 youths. And for this, we were actually using the church platforms and the community platforms. We also worked to promote male involvement in the 6 counties throughout the male forums. We came out and we worked with the male champions. We also engaged the religious leaders through engagement with the radios and the televisions. As you can see, those are 2 of our religious leaders who are talking through the live TV sessions, which was very, very encouraging to see the religious leaders actually going out and talking about family planning in open. That one, it was Kilifi County, where we had Muslims actually talking to the youth about sexual and reproductive health and HIV. In our groups, we also had very young religious leaders who could actually reach out to the young people. And throughout the project, we had one outstanding Ustad called Rashid, who was honored for 2021 Family Planning Champion in Kilifi County. For us, this was very, very important because he was actually recognized in the whole county as a family planning champion. That's also a photo of religious leaders talking to young girls in school just about sexuality, about menstrual health, and all those things like GBV, and it was really good. And also, some of our religious leaders were are actually members of our family planning TWGs in several counties. We also had some trainings on media advocacy, which CCIH came out very strongly. As you can see, these are people from the village, but they are able now to use their phones to share SRH messages out there to the community, and they are really empowered. We also tried to work very closely with the county governments, and we also supported contraceptive days as we were able to do that. In summary, those are the achievement, the family planning messages that we shared. You can see the number, female reached with family planning messages, 33,000 of them, more than. Males reached with FP messages, more than 16,000. Social media posts were quite many also. And so I think you can be able to read all that. That was the launch of the family planning CIPs that we developed in the 2 counties. We actually worked with the counties to develop them. We printed and we disseminated the same. Last but not least, we had a journal. We wrote something on our religious leaders' engagement with CCIH, and I'll mention Mona in this document because we worked with her very closely, and this newly developed Kenya National RH Research and Learning Policy, they actually quoted our work. And so I feel that at the end of the project, we were able to make some impact that the county or the national government could actually, take it up and develop some of these research and learning policies. Lessons learned: when equipped with training, education, and tools, religious leaders are effective advocates, so we should be able to train them. And also, we should try to make them understand what is family planning so that you work together. If we leave them behind, then they will not be able to be engaged. Thank you so much.
Thank you, Jane. You can stay down here. So I'm going to invite our speakers to come sit here. So for those of you who, has anyone here ever participated in a fishbowl discussion? A few of you. So that's how we're going to do Q&A. So a fishbowl is where people sit in a circle, and if you have a question, we invite you to join us in the circle. Can I borrow that? Sorry. Yes. So no one's blinded by the light. Ooh. Maybe that's not going to work. Thank you. Thank you. And then let me just grab 2 more chairs. So the way it's going to work is we'll invite our first, who has a question? We'll invite 2 people who have a question to join the circle. Sir and ma'am in the orange, come join, take a chair, and we'll invite you to introduce yourself and ask your question a short question. And then they'll answer, and then when they're done answering, they'll leave the circle, and we'll have 2 more people join. And so that's the fishbowl format. We hope it's a little bit more interactive, a little bit more interesting. I do have to make sure, can you see them? Because this is being live streamed. Can you see? Is it okay? Can everybody be seen? Okay, so sir, please introduce yourself and ask your question.
Okay. Thank you. My name is Arnab Chakraborty. I'm from Red Orange, based in the Netherlands and Bangladesh. It's a communication agency. And my question to all of you, at least 3 of you, I missed your presentation. I was a bit late, sorry. Thank you very much for the presentation. It was very interesting. What you explained is the process, how you did this, which is engaging the religious leader. I'm very curious to know from you, how you manage to engage religious leaders in terms of messaging. The content. What's the content strategy? or for instance, if when it comes to contraceptives or safe abortion, because this is also, we work also with religious leaders, and this is a struggle that we always have, that we don't know, when it comes to messaging, the content, then it becomes quite tricky and difficult. So I'm very curious to hear from you.
It's a great question. Messages is a great question. Do you mind passing that to Jane? Do you just want to start and we'll go around?
Thank you so much. For the religious leaders, first of all, we identified them, from the congregation or from the churches they are coming from, or the mosques. And then after identifying them, you ensure that you get them, you get the young and the old ones, because the old ones have a bigger say when it comes to saying, this will happen. But the young people also need the young ones to help them. And so for us, we had to pick them up and identify them, and then we had to train them. And in the training, we actually had them sit down and look at the Bible and look at the Quran and come up with their own messages from the two books of God. Yeah? So it's not that, it's actually a process that you engage them from the word go. And as I said, they have really to know what is family planning, what is reproductive health. Because if you don't start from there, they won't understand anything. So after that is now when you engage them for the training, and they come up with those Bible messages from whichever book in the Bible or the Quran. And then those are the messages that we use to pass around.
Which training material did you use on contraceptives?
Pardon?
He asked about contraceptives. What did you use to train them on contraceptives? Which material?
Okay, we have some materials from which we adapted from WHO. Most probably, we can be able to share with you the materials. Yeah, but you make sure that your training is very simple for them to understand.
Does that help? We'll each, yeah.
Thank you very much. In terms of message, what do you say? Do they have history? Do they develop together a kind of message when it comes to contraceptives? No? From the Quran or from the Bible?
Yes.
What do you say? What should they, do you develop a concept, a key message together? I was very curious to hear about that.
Hello. So actually what you do after they look at the Bible and the Quran, they come up with the verses that support family planning. Then from there now, as a team, you develop some messages from that theme. So these messages now, they should be the same messages that every religious leader is passing across. And we also give them reference materials, that we also developed on family planning and HIV. I will be glad to share the materials that we developed with CCIH. Thank you.
Thank you, James. Anything to add about messages?
Not quite different, but just to say that there's a lot that goes into onboarding the religious leaders before you train them. So the preparatory, the discussion of the content and scope of work that you expect of them, and of course their involvement in the development of the materials to ensure their faith speaks into those materials, like she said, the Muslims, Christians, and all that. Then your messages have to be standardized. Of course, there is the religious aspect, but also there's what the Ministry of Health will be giving us guidelines. You have to ensure that it speaks into that. And then post-training, there's the ongoing monitoring and support to ensure that they stick to the standardized messages. And of course, you want to link them to the Ministry of Health structures so that they're not working as silos, but they are fitting into the system. Thanks.
And I'll just add that World Relief, James said at the beginning of his presentation, they have a curriculum that they use that's publicly available on their website. Yeah, so Wilma or Peter, anything to add? Otherwise, I'm going to move to the next question.
I'm going to give a little different context, because the way our approach, we pair our religious leaders with a health technician. So the way we go about it is we go into a community, we go into a workshop, and then the religious leaders will give the religious argument in favor of family planning. And once they go through that, they actually, in Senegal, they wrote a Islamic argument in support. So it goes through all the different texts, the thinking process. It has messages from the local religious leaders. And then after they go through that process, then the health professional comes in next and does all the health technical aspects. So they'll bring an IUD, they'll bring examples of the different methods. And so it's a really dual approach where they do the religion and then they talk about the health.
Thanks, Wilma. Can I invite you to ask your question?
Yeah,
Sorry,
it was
Peter.
actually the exact same question. So, sorry, my name is Mieke Baks. I work for Health Action International, working together with Faith Action as well. So I came up with a different question, which is, so I understand the messaging and how you get people to come and join the program, but there must be, what happens when there are like more conservative faith leaders? Do you have special techniques, or is your technique to first approach more moderate faith leaders, or how do you go about this?
It's a good question. So if you have faith leaders that are resistant, I'll put it that way. If you have resistant faith leaders, how do you approach them? Anyone want to take that first? Peter? No?
Okay, I will share something, but I also see a hand from Sheikh Bake. Okay, yes. Okay. When I'm Muhammad, I'm different. I think what we have done in the case of those that have a more conservative view is that we have gone through a process of coming up with what we call theological briefs. Theological briefs that look at the whole argument that you are having on an issue. In our own case, we have gone through a whole theological brief, both from Muslim scholars and also from Christian scholars on a bill, sexual reproductive health bill. Every clause, what does the Quran say about it? What does the Bible say about it? And out of it, then you have their own sessions, internal sessions, where they themselves now explain, those that have done the theological briefs, explain to the other religious leaders how they interpret. And then they also get counter-interpretation. So they have their own arguments, internal arguments, until they reach their own consensus that this is now what we adopt. And after that, then it becomes very easy to work around with something they have consensus around.
It's very important, the internal discussions, right, before they say anything publicly. I agree. Any of the three of you, any other ways that you deal with resistant religious leaders?
Yeah, I'll say for our case, it wasn't really a case of onboarding resistant leaders and start working with them. Rather, we were selecting at the initial stages to deliberately bring on board people who are already willing to work through the program. So we explained the extent of what we wanted to do. And I'll say we didn't get much resistance or conservativeness from the church point or the mosque point of level, but maybe individuals. And so we did not recruit those individuals into the system as to be trained. You don't want to train somebody who, first of all, will not be willing to give the messages. So that's how we went about it.
Thanks, James. Wilma?
So in our case, we did have some hesitant religious leaders, the Quranic teachers, who weren't sure what their role was in discussing family planning. And so we're really meeting them where they are. A lot of times this is the first time they're hearing about this, or they've heard it from other sources and they're not sure what to make of it. And this is the first time they're engaging with other religious leaders who are in support of family planning. So we are going to do follow-up with them and try to bring them on board, but we also invite them to dialogue to discuss what their hesitations are, what the myths are, and we invite them into the process to examine the different passages for themselves and then reflect and then have them, not necessarily be 100% on board with us, but to be open to exploring the possibility.
Thanks, Wilma. Jane, anything to add?
Yeah, I think for us, the religious leaders were actually excited to be advocates. And in the beginning, they didn't have any much information about family planning or reproductive health. But when we took them through the class, they were excited because we were making them more knowledgeable and able to talk about family planning to their congregation. But I remember there was only one religious leader after the training who said, oh, I can't do that, and she actually left the group. But then even during the training, we would ask them if they are comfortable talking about family planning. Yeah, and so all of them, apart from one, was able to do that. Yeah, thank you.
Thank you. And thank you too for your questions. Thanks for joining the fishbowl. Yes, 2 other people. Sir, ma'am, come on in. We have 2 new people. Hi. Hi. Okay. I'm going to go with ladies first. So please introduce yourself and then yes, and then ask your question. Thank you.
So, hi, and thanks for your interesting presentations. I'm Jannemiek Evelo. I'm the Executive Director of Choice for Youth and Sexuality based in Amsterdam, the Netherlands. And my question relates a bit to how to get religious leaders on board when discussing family planning. And recently, I was in the International Dialogue on Population and Sustainable Development. And then what was shared was that the concept of sexual and reproductive justice or reproductive justice was really helpful in engaging religious leaders, because justice is a concept really recognized by a lot of religions and mentioned in the Bible and the Quran. So I was wondering if you have any experience with using this terminology, and if not, what is your perspective on it?
Oh, interesting question. Has anyone used the term reproductive justice? No? No. Okay. So I guess it's maybe a newer term.
Yeah, maybe, but maybe your thoughts on it, whether it would be.
Yeah. Do you think it would be, so she's asking if you haven't used the term reproductive justice, do you think that terminology would work in the faith community that you work in? Do you think people would like that term? Like, what do you think it means or no? James, were you going to say something?
Yeah, I wanted to start by saying that we've not used it or we've not applied it before. And as to whether they'll warm up to it or not, I wouldn't want to speak for them. I just want to say that when we were developing this material and we were discussing with the faith leaders and we invited them to give their input, as a project implementer, sometimes you have your own prejudice and you're thinking the faith leaders will be opposed to this or they'll think this is bad. We were shocked at the response they gave us. They were so receptive of the messages. So I wouldn't know really what they'll think about the reproductive justice when we front it to them. Maybe it could be something. Want to try on another level.
Yeah. Thanks, James. Does anyone else want to respond? Maybe one more person or Wilma? Thank you.
So I think terminology is such an important aspect of engaging with religious leaders. And it depends on how you frame it. So what does reproductive justice mean? What is the religious leader's role in that potentially? And how can it be applied? In our context in Senegal, my colleague often says there's more than one way to approach a topic and more than one way to say it. So it really, I think it would depend on how we frame justice and how we would present it to the religious leaders. And in our experience, we definitely approached it through a maternal and child health perspective. So providing the data, providing, how these interventions, how these programs can impact the maternal and child mortality rates.
Thank you, Wilma. Nasir, would you like to ask your question?
Yeah. Can you hear me? Okay, thank you so much for this lively discussion. I just want to go further down. I mean, you are inviting a religious leader, somehow you convince them and they are participating in your training, you have developed a curriculum. Up to this is not that difficult. Then after that, when they're going back, what role they are really playing?
So after you've trained a religious leader, then
Exactly.
what? Like what are they actually doing in the community when they're
Because
talking about family planning? Is
This
that-
morning I was attending in a private sector, on presentations, they are saying making a policy is easy, then implementation of policy is much more harder. So in here, providing training, sitting for 5 days, having something, good things, good food. Then the question is when they're going back, what role they are really playing, how many of them are, just kind of ideas, how active they are, or what percentage of them are really playing their role.
So after the trainings, what did you actually see them do?
Maybe if I start, just to say that at the point of training, they also come up with their own schedules. And remember, you're not converting them to become program implementers. They have to work within their own structures and within their own systems. So a lot of the times, they will have maybe inclusion of family planning messages during sermons, when they are doing pastoral work, evangelism, if that is what they are doing, then they include those messages in their own normal work. The point is that they don't exclude those messages, or they don't completely ignore them when they are doing their normal work.
Did anyone else want to add?
I would have answered the same.
Elementary question. I mean, any religious gathering like Sunday for Christians, church, or in the mosque. So after having this training, when they are getting any chance in related gathering, are they really providing those messages? I'm not expecting, okay, every time they will be talking, but when the opportunities come, they are really using those opportunities to providing those messages.
So maybe you guys could give just a couple examples of where are they talking about family planning? Yeah, James.
Yeah, we have an inbuilt mechanism to track that, and we can report that on a monthly basis, or even including the key messages that which topics are more discussed and how many people were reached and what avenues were they, through schools or through Sunday schools or through madrasa or through community activities. So and that was one of the reasons why we deliberately had them develop a post-training action plan, which we are supporting them and monitoring them to implement. So we're able to track what messages are being given and the forums and what frequency, yeah.
Action plan, very important in tracking. Jean or Wilma, did you have anything to add or no? No, yeah.
So ours is a little bit more organic than that, because religious leaders that are in our network are the people turn to, like during marriages, during baptisms, in all those different life milestones, religious leaders are often present. So we don't have a mechanism to track, like specifics, but we have talked to a lot of community members and religious leaders about when family planning messaging may come up, and it's more organic in those conversations when those milestones happen.
I think if I could just give my opinion, as program people, we are often responsible to donors for monitoring and evaluation. Religious leaders just think that's a pain. To be perfectly honest, so do many program people. But anyway, even if you love monitoring and evaluation. But I think what I have learned is one of the things we did to make it easier on religious leaders in a project we were a part of is we created WhatsApp groups. And their way of reporting was they were reporting to the other group of religious leaders, and then the program people kept track of that to make it easier. They would submit a photo, they would say, this is what I talked about, this is how many people were there. We tried to make it as easy as possible. We tried using Google Forms, like anything that was easy for them, especially some religious leaders don't have smartphones. Some of them don't have data. Some are in very rural areas. So it's a bigger question about how to track what they're actually doing. But thank you for your questions. Ma'am, please join the circle. And yes, and these will be our last two because I'm very conscious of time. I will end us on time. So please introduce yourself and ask a question.
Hi, my name is Corey Warnell. I'm a Youth and Reproductive Health Technical Advisor with USAID. And my question, obviously, is probably going to go to the youth, right? I've heard a lot about talking with the religious leaders about family planning, but we know that a lot of, especially girls, are married young in order to protect their virtue. So, you know, trying to get them married before they lose their virginity, which actually puts them into a harmful child abuse situation. Are you talking with the religious leaders about sexuality? And I don't mean like orientation, but more just that adolescents are sexual beings, but still have a right to not be abused. So they will be sexual beings who deserve family planning, but they also deserve to not be put into a marriage or put into an abusive situation.
Very important question, Corey, about youth. Who would like to start? Jane?
Yeah, our messaging is quite a range of topics. And it's not just FP alone, but we talk about so many things. Remember, our target is from 10 years of age. Obviously, we don't expect those to be married. So we're talking about things like puberty and body developments. Then we come to life choices and making choices for better future, preparation for marriages and all those things. So it's actually a range of topics that will cater for anyone between 10 and 24 years. And so I would expect that that's catered for, that we're not just going into family planning alone. So we look at quite a number of things. Thanks.
Jane, were you going to add something?
That's very true. Apart from family planning, for our program, we actually had SGBV, and all our religious leaders were actually talking about it because it's actually a problem in Kenya. And so they were actually getting men together and talking about it because more so it was coming from the men. So they had men-only forums where they would sit down and have lunch together and talk about those issues at the community level. This was also taken up at the churches and the mosques with every other person during the services. Yeah, thank you.
Wilma, were you going to add?
Yes. So our group, the CRSD, actually just wrote a religious argument on youth and youth and health. And in the beginning, so this was quite a long process because in the beginning they knew they wanted to engage with youth, but they weren't sure exactly how to go about it as religious leaders and living within their religious values. So they worked with the Ministry of Health in Senegal and they came up with a list of topics that impact youth. So it ranges from mental health, menstruation, early marriage, early pregnancy, a lot of the different topics. And so the religious leaders took that and consulted their religious communities. And they decided on the language they wanted to use, how they wanted to go about it, and also finding passages from the Quran and the Bible to support their views. And so now it's in draft form, it will be out soon. There's this document that they are going to use to discuss with religious leaders on how to discuss youth topics and how to engage with youth. And also it brings it back to like the family, the home, and how to engage parents in talking to youth about these different topics.
I think I would just add 2 points. The first point is that we have had a lot of dialogue within the faith community, and I'm talking about interfaith, around the issues of sexuality, youth and sexuality, around the issues of rituals of passage for youth, and especially those that involve boys, if it is circumcision, and the education that goes in there, as well as other practices like female genital mutilation, as we call it, FGM, early marriage, and what are the effects. And there are situations where we have had, especially among Muslims, we recently had that not long time ago in Tanzania, where the Muslim supreme body passed what we call a fatwa on early marriage, yeah, so that girls can stay in school up to the point when they are of age, yeah, because the moment at least a girl can be able to stay in primary school and in secondary school, they are likely to pass beyond that and go to college. And they would prefer to go to college than get married at that particular moment. But at primary level, they do not have a lot of decision-making power and a lot of choices in life that they are looking at. So keeping them in school as much as possible is what we look at when we are considering some of these things.
And still supporting the fact that they are sexual beings, but that, right? Like that's kind of what I was getting at, is to make sure that like it's acknowledged and supported that they are sexual beings without putting them in dangerous situations.
Yeah, I think we've been working with religious leaders a lot on the dangerous situations aspect, especially when it comes to child marriage. I think it's a work in progress, and I think some faith communities are further along than others. I will say, when I've seen those issues and sexuality talked about successfully, is when they bring a healthcare worker. So it's a religious leader and a healthcare worker paired together, so that the religious leader, yes, they've learned some things, but they're not the expert. And so they bring someone they trust, the religious leader trusts that person, and they're saying to the community, you can trust this person for information on sexuality. And we've seen that work well. I think in terms of language on sexuality, I don't know many religious groups that use the term sexuality. So it might be around puberty or your changing body or something like that. But yes, hormones, things like that. But thank you, please.
Thank you very much to our presenters. That was really good. We have some lessons to take back home. My name is Beatrice Kwachi, and I work with Japaigo, Kenya. And my question goes to Wilma, most probably because you are the only one from Kenya. For our Kenya counterparts, I'll ask back home. Yeah, so you talked about, my question also is on the youth and young people. You talked about young girls accessing contraceptive services. So I was just curious to know, like, what ages are we talking about? And also, most likely, which are the methods that they are mostly leaning towards? Are they short-term, long-term? And of course, we've talked about this messaging and all that advocacy that made them to come, but just the age and the methods that they were preferring. Thank you.
So we're not quite at that point yet. So we're working with the godmothers in these Quranic schools because they are the influencers. They're the trusted source to talk about the different aspects of puberty, youth, adolescent, sexual reproductive health. It ranges. There's no formal age where girls can enter the Quranic school system. There's no formal age where they age out. So it really is a range from anywhere, you know, mainly we're targeting from about 8, 9, 10 through teenage years. But they, right now we're just talking to the godmothers and the Quranic teachers about discussing this. So we haven't gotten to the different methods and like what's available and how to go about that.
Oh, great. So they just come, it's what they're receiving right now, it's information. Information.
It's information,
Okay,
yes.
Thank you.
Thank you both for your questions. Thanks for entering the fishbowl, as I like to say. And thanks for those attending. I'm just going to ask our speakers if they have 30 seconds of something they'd like to say that wasn't discussed. I've heard a lot about protocol, the protocol that you have to follow when working with religious communities. I've heard a lot about the importance of messaging, the importance of relationships and building trust. I'm sure you've all heard other things. I think that would be true any type of community you're working in, not just the religious community, but especially important for those reasons. But Peter, your 30 seconds of closing.
I think I just want to re-emphasize a point that the faith community is for family planning. The faith community supports sexual reproductive health. But engaging the faith community requires that also you give them a safe space, first, where they do their internal reflection, yeah, and dialogue before they can finally be able to come out and have confidence to talk about these issues in public.
my takeaway and my final points would be engage the religious leaders from the beginning and go in with an open mind and not with a prescription. Religious leaders are on their own time and will come to terms with the different aspects of reproductive health. In the beginning, they didn't even want to present on television. They said, we're not ready for this. So we're happy to do radio, but people are not ready to see our faces on TV. That has evolved. They're more than happy to do it now. And also with the issue with youth, when they felt like they were pushed to engage with youth, they weren't sure how to do it. They felt that they were cornered and they were just like, we don't know what to do with this, so we're just gonna stay silent. And they came around to this. They are the one who approached the ministry to come up with this argument. So it's not on the pace that we might prefer, but it'll get there.
I think I'll just close by saying that faith leaders are key stakeholders in family planning and RH services, but they don't operate in isolation. So it's important to link them to the key ministries, like we know family planning will be domiciled in the Ministry of Health, like for the case of Kenya. But if you're going to talk about youth, then you have to bring in the Ministry of Education. So you'll have to bring in other community leaders like the chiefs and village elders and all that. But also just to emphasize the point Mona said, that you don't want to burden them with M&E. Make their work as easy as possible so that they don't look at it like they're having to write several other things. Thanks.
I would just say that majority of us Africans in the African continent, majority of the people are believers in one way or another. And so we cannot put religion out of people's lives. So it's one component that is very important. And therefore, we need to engage the religious leaders for us to succeed on issues of reproductive health and more so on family planning. If we want our programs to succeed, let us engage the religious leaders. They can change the norm on family planning. Thank you.
Thank you. Thank you to all of our speakers today. I'd like to close with what we in the Christian faith call a benediction. And it's actually a Franciscan benediction, so it's Catholic. I'm not Catholic, but I think it's a good one. So if you guys would stand with me, I'll read it. It says, may God bless us with discomfort at easy answers, half-truths, and superficial relationships, so that we may live from deep within our hearts. May God bless us with anger at injustice, oppression, and exploitation of God's creations, so that we may work for justice, freedom, and peace. May God bless us with tears to shed for those who suffer pain, rejection, hunger, and war, so that we may reach out our hands to comfort them and to turn their pain into joy. And may God bless us with just enough foolishness to believe that we can make a difference in the world, so that we can do what others claim cannot be done, to bring justice and kindness to all our children and all our neighbors who are poor. Thanks for joining us today. I hope you have a great rest of your conference.